Oh, welcome back this morning. We're here with Mohamed Osman. He's from Essentia Community Health for our latest segment on holiday health and wellness as our special week of bringing you how to manage your health and stress around the holidays. Mohamed, thank you again for coming into this morning.
Thank you for having me.
So obviously, healthcare stress is one of the big stressors year-round, but especially this time of year during the holidays when you add on the stress of all of the holiday celebrations. So how much does that stress impact the people you communicate with community health who might be struggling to get access to their health care?
It does a lot. So think of someone that doesn't have access to food. On top of that, the holidays coming, they got family members, maybe they're coming or they want to visit someone. The stress of, we're accustomed that since it's on holiday, we have to give present and all those things. But if someone doesn't have those resources, it increases the pressure on them. So as a community health worker, what we do is find those resources that we can help with our patients, such as food, transportation, winter clothes, anything they need within the community. We help them find those resources free of charge.
Mm-hmm. And obviously, in your work, how much has it come as a surprise to you the amount of resources that are available? And is there? Obviously, demand is always growing for these resources, but the amount of resources that are out there, has that been a surprise to you or the people you've been working with who need access to these things?
Absolutely. There is a lot of resources available. But as the saying goes, sometimes it's not what you know, it's who you know. People will surprise when sometimes I deal with patients that have a struggle with transportation, for example. But they don't realize that their medical insurance, especially Medicare, and the expansion program does provide medical transportation, non-emergency medical transportation. And some people, they've been struggling coming to the doctor's appointment because they don't have a ride. And some people don't, maybe they're seniors. Maybe the bus doesn't stop at where they live, or maybe it's a little longer for them to walk. And they don't qualify for paratransit. But when I tell them that there is a medical transportation that can come to your house and bring you to the doctor's office, they're surprised. They didn't know that. So there is a lot of resources available. It's just a matter of educating people, let them know that we do have resources, that they don't have to struggle. They don't have to worry about it.
And how much do you see in the clients you guys work with, the change in that level of stress once they are able to see that they might be struggling with bills, they might be struggling with different, paying for food, paying for rent, things like that, but that they're able to get some of their needs met through these programs?
Yes. For example, for medical, if whatever is left over the insurance, Essentia, for example, they do provide financial help for people based on income. And a lot of people do qualify they will pay the 100% of that one. But also when it comes to rent, there is the CARES partnership through the 211. We do call them, these are local churches that sometimes we connect people to. So there is available resources. When we help patients and connect to them, those resources, they're very surprised. Even sometimes help them fight an eviction. So I did help another patient about 2 weeks ago. She was already get the order to get eviction. I was able to help them through the Great Plains Fair Housing, and that eviction was at the end of the day recalled, and now she lives in her own apartment. So there is a resource available.
And how important is it for people who might be struggling, especially at this time of year? Obviously, we just saw the cutoff from SNAP benefits, now reinstated, obviously, but these struggles around getting access to these programs in the government. How important is it for people to know that there is still help out there?
It is. So, for example, in my office, Southern University Clinic, I do have a food boxes. So, essentially, we partnered with the food bank, so we do buy food from them. So, for example, to begin with, if someone is struggling with the food right away, I don't give them homework. I'm not just tell them this is where you can find them. No, I'm going to give them something to start the day with. I'm going to give them food. At least if someone is already struggling with the food, I don't have to tell them that, hey, go this place. So I give them something to start the day, and then we put a plan together on how to get the next meal. So if they need to apply for a SNAP, I know now SNAP is back, but if they don't have one, we do help them apply for that one, and we connect them with the food bank. Of course, and then the senior ones, if they cannot go to the food bank for some reason, then we connect them to Meals on Wheels, which is a very nice program. So they eventually approve them right away.
All right, well, Mohamed, that's all we have time for this morning. Thank
No
you so
problem.
much for joining us.
Thank you
You can
for-
find more information on all the resources that Community Health offers on our website after the show, as well as registering for that Doc Holiday giveaway through KVRR. We'll be right back in 2 minutes.